Guys, this is Mobeen. Thank you very much for being here. Before you watch this video, I want you to make sure that you are aware that this video is for the educational purpose only. All of the material on Dr. Bean and all the material that I present is for educational purpose, especially for healthcare workers who are studying or who are practicing. Sometimes the drugs that we discuss here have a very narrow margin of safety. That means that if slight overdose or even slight other comorbidities that you may have or any other thing that you're taking in addition to if you take this, it can lead to even death. The discussions here that I'm doing are to figure out that can these drugs, they may or may not be able to help in, for example, current pandemic of coronavirus or COVID-19. Guys, this is Dr. Mobeen. The video discussion that you're about to see is about the hydroxychloroquine and chloroquine. And I wanted to make sure that you are aware of the toxicities before you watch the video. So let's look at this for chloroquine and hydroxychloroquine. This is the book reference. I'm giving you the book reference so that it's not just Mobeen saying something. It is Goodman-Gilman 13th edition. And look at the safety margin is narrow. A single dose of 30 milligram per kilogram may be fatal. It can kill the person. Cardiovascular effects include hypotension, vasodilatation, suppressed myocardial function, cardiac arrhythmias. Arrhythmias can cause death and eventual cardiac arrest. That means death. Confusion, convulsions, and coma may also result from overdose. Chloroquine doses of more than 5 grams given parenterally usually are fatal. They're just fatal. They just kill the person. Look at the GIT upset, headache, visual disturbances, and urticaria. Pruritus, itching on the skin, also occurs most commonly among dark-skinned people. Prolonged treatment with suppressive doses occasionally cause side effects such as headache, blurring of the vision, diplopia, confusion, convulsions, lichenoid skin eruptions, bleaching of hair, and look at this widening of the QRS interval and T wave abnormalities. These things can lead to the cardiac arrhythmias. Cause toxic myopathies, heart issues, toxic heart issues. Heart can stop. It can be so damaged. Cardiopathies and peripheral neuropathies. So please do not take these drugs without doctor's prescription. Rarely, neuropsychiatric disturbances, including suicide, may be related to overdose. Chloroquine inhibits CYP2D6. This is an enzyme that helps with the liver with the metabolism of various things, and thus can interact with variety of different drugs. Chloroquine opposes the action of anticonvulsants and increases the risk of ventricular arrhythmia when co-administered with amiodarone or halofantrine. Guys, this is Mobeen. Today we're going to talk about chloroquine and hydroxychloroquine. These are both 4-hydroxyquinoline derivatives. What happens is that here is the derivative, if you can see here, this is the 4-aminoquinoline. What we do is we attach side chains to this to make chloroquine and hydroxychloroquine. This side is hydroxychloroquine and this is chloroquine. The basic difference between them, they both are, the most important thing to keep in mind are that they both, this side chain, this and this side chain, they both are basic in nature. They both are basic in nature. So what they do is they make this molecule a weak base. So chloroquine and hydroxychloroquine are actually weak bases. And this is a very important thing because we're going to take advantage of this behavior of them, this weak basic behavior of them. So now what happens is when we administer them in the body, they are very well absorbed from the oral route. They have a great volume of distribution. They can be distributed almost to all parts of the body, but they have a special gravitation or affinity towards the areas or the parts of our body which are acidic. And so there are a couple of things to keep in mind right in the beginning. Number one, these drugs have been used in autoimmune disorders because in the autoimmune disorders, one of the outcomes is that our body's environment becomes acidic. So our milieu is acidic. And because of that, when we administer these drugs, you would find that these are more in the blood. Their concentration is more in the blood of a patient with autoimmune disorders than not. So they just gravitate towards the acidic environments. That also is true for them to gravitate into the acidic environment inside the cells as well, which is really beautiful. And the important thing is that inside the cell, our cell has an acidic environment. Number one, the cytoplasm itself. So over here in this diagram, this is our cell, and this cell has an acidity in it. Then the cell itself has vacuoles in it, which are lysosome, which are digestive material. You can call them stomachs of the cell. They are also acidic. Why? Because these vacuoles, these vesicles that are lysosomes, we call them, they have the acidity in them to digest the breakdown products from within the cell or from outside. When this cell catches a thief, which is a virus or a bacteria, it would bring that and put that in this vesicle, in this lysosome, and break it using the acidity. So the cell cytoplasm itself is acidic, then the lysosomes are acidic. Then this is really important, and this is pertinent to the discussion today. We're going to talk about SARS-CoV-2 and look at how coronavirus may be impacted by chloroquine and hydroxychloroquine, how it may be treated. So again, I'm saying maybe. So let's say this is the endoplasmic reticulum. Endoplasmic reticulums are structures in the cell that help with the protein. They contain the machinery to produce proteins or the enzymes of the cell. Virus uses this area, especially this SARS-CoV-2, the virus uses this area to make its own proteins, and then it assembles itself into new viruses. So for the virus, this blue thing that I made, the endoplasmic reticulum or the rough endoplasmic reticulum, is really, really important. And then I'll make one more structure here. Let's say this is the Golgi apparatus, GA. This is also important for the virus because after coming out of the endoplasmic reticulum, the virus would enter the Golgi apparatus. From there, Golgi apparatus would help it go out of the cell. So that is a kind of the process for the virus to come in. And you would see that these environments, the endoplasmic reticulum and Golgi apparatuses, these are also acidic. They contain enzymes in them, they contain machineries in them that are working. And so they need to be acidic for these enzymes to work. So I think you're catching it that if we give a drug that is a weak base, so that is a basic drug, it is going to go to these compartments and reduce their and increase their pH, reduce their acidity. And if it reduces their acidity, if it causes their pH to increase, the enzymes, the machines that are sitting in there may not work correctly. And that is the mechanism that may be useful for us to avoid coronavirus or reduce coronavirus replication in the virus load. So let's think about it once again. I'm going to go back here. We were talking about the chloroquine and hydroxychloroquine being 4-aminoquinoline derivatives. Please remember this, that hydroxychloroquine is preferred over chloroquine because of the less risk of retinopathy, damage to the eyes, by hydroxychloroquine. So whenever I'm talking about chloroquines and hydroxychloroquine, assume I'm talking about chloroquine. So they both are basic. When we administer them into our bodies, so here, when we administer them in the body, they make the body's environment a little bit less acidic, especially the environment inside the cell's organelle and the cell's cytoplasm. These drugs are used, they used to be used for anti-malaria, and even over there, so let's say that this is the plasmodium, the protozoa that that hurts us, Plasmodium falciparum. Nowadays, these guys are pretty much resistant to chloroquine and hydroxychloroquine, so we use other drugs. But let's say that this is a non-resistant Plasmodium. What happens is the hydroxychloroquine or chloroquine go in, and this Plasmodium, this little protozoa, has its own stomach, which is a food vacuole. And this drug goes, I'm going to make it in red, and it sits down in the food vacuole. And just like our own stomach, this protozoa also wants to have its stomach a little bit acidic so it can digest heme that it is taking from us. The blood has heme, and the heme goes into this vacuole. So what happens is, let's say this is our blood vessel, and this guy, the mosquito, helped it take an RBC from us, and that RBC has heme in it. I'm going to make that in black, and that heme eventually ends up into the falciparum. So as this heme ends up in the food vacuole, inside the vacuole there are enzymes that are going to polymerize this heme into hemozoin, and that is a structure that this Plasmodium can work with. However, when this drug is in there, when we have the chloroquine or hydroxychloroquine, they reduce the acidity, so they kind of make the stomach of the Plasmodium less efficient. And because the acidity is reduced, what happens is that the heme is not polymerized, and as the heme starts accumulating in this thing, it is toxic to this protozoa and it kills it. That is how the chloroquine and hydroxychloroquine kill the Plasmodium. Now let's go here and look at how do we use it? Of course, we use it as antimalarial. We also use it for autoimmune disorders. For example, for SLE, we use it for rheumatoid arthritis. We use them for cutaneous dermatomyositis. We use them for peripheral cutaneous cutaneous tarda, sarcoidosis, HIV, and many other diseases. Do you know why these two drugs are used for derm, for the skin conditions? And do you know why these cause retinal toxicity? The reason is the same. These drugs have a strong affinity to melanin, and that is why they can go to the eye and stick to melanin and cause damage there. And similarly, they can go to the skin and be gravitated towards the melanin cells and then do their clinical action on the skin. So autoimmune disorders, especially rheumatoid arthritis, SLE, and then many other, including HIV and sarcoidosis as well. Of course, HIV is not autoimmune, it's a viral infection. Now, how does this work? And how does this work for coronavirus? Look, what happens is, coronavirus's first need is that the fusion of the virus. So when the virus comes in, so I'm going to make the coronavirus here. So let's say this is the virus. The virus has a spherical structure, and on that spherical structure, this is my spherical structure. So on that spherical structure, it has spike proteins. It has spike proteins, right? And there are many kinds of spike proteins on this structure. We are interested in the spike proteins that are called S proteins. And what happens is that these S proteins, this virus is going to bind to ACE2 receptors on our cells, and the S protein of the virus, they bind together. So let's say this is the virus or virion. When they bind together, that then initiates the process of pulling the virus in the cell, or endocytosis. And if the cell is properly acidic, then the virus starts a process of fusion with the membrane of our cell. So if I go to one more stage, so let's say stage number 2, what happens is the membrane of the virus, or the envelope of the virus, fuses with our cell membrane, and if this was the RNA in it with the capsid, the proteins around that, so we call it nucleocapsid, that nucleocapsid and the RNA gets internalized. This fusion is only possible if the cell is acidic and it's properly acidic, optimally acidic. So the first function of hydrochloroquine or chloroquine is that it reduces the acidity in the cell, so the fusion of the virus reduces. So that is one effect, one way that this chloroquine and hydroxychloroquine can help. Second way, when the virus becomes internalized, so here it is internalized, this guy, the red guy, then it starts getting replicated. And the way viruses replicate or increase in number is they make their parts, and then they want remember this blue thing here, endoplasmic reticulum? They want our endoplasmic reticulum to assemble them together into a virion again. So these are like little cars that need their parts to be made separately. And then inside the endoplasmic reticulum, there are enzymes sitting there which put them together. And for that as well, we need proper acidic environment. And hydroxychloroquine and chloroquine can actually go into these organelle and reduce their acidity, make them basic. And when they become basic, the enzymes reduce their function. And when the enzyme function is reduced, there will not be much assembly done. So that is the second way. What is the second way? The organelle function is stalled, is reduced, it's slowed down. Same is true for the Golgi apparatuses as well. So I'll call that the second way as well. So the first way hydroxychloroquine and chloroquine can help is that the cell's cytoplasmic acidity is necessary for the proper fusion of the virus virion and the cell. So that can be impacted. Second way it can help is that the organelle, they have less acidic environment now in which their enzymes do not work properly, their machines do not work properly, and that would cause the virion to be replicated or assembled slowly. So these are the two interesting mechanisms. A third mechanism is with the zinc transport. And so there have been some studies around that. And what that is this. Imagine this is our cell. And inside the cell, when the virus RNA comes in, so this is the virus's RNA. Virus's RNA needs an enzyme called RNA-dependent RNA polymerase. So this is that enzyme. RNA-dependent RNA polymerase. RDRP. This enzyme will work with this RNA that virus has brought in and then help create more of these RNAs, help create the messenger RNA from that, help create more proteins from it, which are virus proteins, which then get assembled as I talked about before. So I'm not doing the virus replication function here, but important thing is to understand that this enzyme, RNA-dependent RNA polymerase, is necessary to be able to convert or increase the virus in number by making its parts. Zinc, in a study, people said, and these studies have been shown many times in videos and they're present on the Google as well. So I don't want to go in too much detail here, but basic idea is that if zinc is inside the cell, zinc will bind with this enzyme and disable its function. Now this enzyme is needed for coronavirus as well to replicate or to increase in number. So imagine the coronavirus RNA-dependent RNA polymerase is sitting there saying, okay, I'm going to go make more coronaviruses, and here comes zinc and binds it, and that thing cannot work anymore. The problem is that the zinc is a molecule with an ionic charge on it, and cell membranes do not allow charged particles to move through them. So the result is zinc cannot just come in. So it is speculated that, or let me say that study said that if we give chloroquine, then chloroquine can act as a channel which can pick up zinc from outside and help it move inside the cell. It acts as a gate. It acts as a channel. And we have many such kind of channels that help things. For example, there are glucose channels that bring glucose from outside to the inside. So cells have all kinds of channels on them that allow various kind of materials to come in or go out. And the cells selectively decide when to open them and when to close them. It's just that the cells do not have a channel for zinc. So if you start eating zinc today, that's not going to do anything because cells do not have channels for zinc. So it's not going to go inside the cell. It's not going to stop the virus from doing its function. But if there is chloroquine available as well, then chloroquine can act as that channel in the cell, which would allow, these are called ionophores. So which would allow the zinc to go in. And when the zinc goes in, it is going to, now let's say the virus comes in the cell as well and says, okay, I'm going to replicate and increase in numbers, and zinc is present there, and the RNA polymerase or the RNA dependent RNA polymerase gets bound to the zinc and the replication reduces. So these are the three very important functions through which chloroquines and hydroxychloroquine can help reduce the coronavirus or other viruses replication. This is maybe the reason that these are effective in HIV as well. Of course, they are effective in inflammation or autoimmune diseases, and that effect is basically, number one, they reduce the T cell CD154 expression. So T cells are immune cell, and 154 is for them to be able to connect with the antigens and respond. So you can say they reduce the T cell activity. T cell are cytolytic cells. They beat up other cells and pathogens. They are also helper. They amplify the function of the immune system. So the chloroquine and hydroxychloroquine, they reduce the T cell activity. That is one. They reduce the B cell activation, and they reduce the dendritic cell activation. B cell make the antibodies. Dendritic cells sit in our lymph nodes, and they help B cell become more refined. All of those would actually reduce the inflammatory responses. But please remember this, compared to other immunosuppressants that can be given in some autoimmune diseases, for example, methotrexate, this drug have been very safe. We haven't found patients that have been taking this drug to be immunosuppressed, that they develop infections. This actually has been very protective. As you can see, that it is kind of a very decent antiviral as well. And we hope that this would help with the coronavirus too. It was helpful against SARS-CoV that caused SARS in 2002 and 2004. So hopefully it will be useful. A couple of things about these drugs, their toxicity. In the low doses, there can be some GIT disturbance and skin rashes. In the high doses, there can be hemolysis, there can be retinopathy, there can be severe skin conditions, there can be cardiomyopathies, and there can be auditory impairment as well. So just keep that in mind. Interestingly, in the normal dosage, in the pregnant women, the guidelines are that if the woman is taking hydroxychloroquine for some autoimmune disease, they can continue to take that during their pregnancy. Most important toxic effect is, of course, the toxic retinopathy. Because of that, the guidance is that do not use more than 5 milligram per kilogram actual body weight per day. So that is the maximum limit put on the dosage for these drugs. Finally, some discussion about the contraindications and cares. So it is said that don't use this in epilepsy. Don't use this in the patients with neuropathies. Do not use it in patients with myasthenia gravis. Of course, during the renal failure, because 68% of this drug is cleared via the kidneys unchanged, and the remaining in a metabolic form but through the kidneys, the renal route is a primary route for the clearance of this drug. If the patient has a renal failure, then the drug toxicity can occur. So just be careful for these things. And that is the discussion for today. Thank you very much for your time.